It's a Northwest lifestyle weekend on Komo News. Now back to IRG's Health Talk.
Back with Tom DeBord, COO of Overlake Medical Center. Project FutureCare, Shannon. Looks like a worthy project. We're going to learn more about that in a minute here.
Yeah, big activities on the east side with Overlake, trying to reach out and provide better care and great care to the community over there.
Okay, let's get to Tom DeBord and Shannon O'Kelly.
Tom DeBord, thank you so much for joining us here on Health Talk. How are you?
I'm doing great, Shannon. Thank you for having me. I'm excited to be here.
Well, it's great that you're here. Hey, tell us about your job. You're the COO at Overlake Hospital. COO, that's a big job. Tell us about your role there.
Great. Thank you. Yeah, I'm the Chief Operating Officer, so my official role is really responsible for day-to-day operations at the hospital. So I get involved in everything from all the clinical care that occurs to the support structure, all the engineering, housekeeping, and other services to basically help take care of our patients. So it's really the gamut of everything that goes on across the hospital every day. So I'm really blessed to be able to do that.
Well, it sounds like a fantastic job. It sounds like a busy job, and it sounds like it's a fun job. And it must be fun right now because there is a lot of stuff going on in healthcare. And I know that I've been in the Bellevue area and the Seattle area, a lot of growth. And I know Overlake is growing because I've driven by and there's bulldozers and cranes and a lot of activity going on. What's going on in your organization? A lot, I know, but tell us what exactly is going on.
Yeah, Overlake's growing just like the East Side community is growing. And so we're doing everything we can do to match that growth within the community. And so right now we've embarked on a 6-year campus expansion, which is really the largest campus expansion in Overlake's 60-plus year history, which we're really excited about it. We call it Project FutureCare. It's really 3 main components. We're building a new bed tower, we're building new operating rooms, and we're building a new behavioral health unit, which we're really excited about.
Well, ultimately, I mean, you're building this to provide care to the growth in the population, and the idea here is to give services or provide services that you feel that are needed. How do you assess the needs?
Yeah, we do a lot of work. We have a community needs assessment that we do. We also work with our physicians. We have great physicians at Overlake and on the east side. We do a lot of strategic planning where we include our staff, we include our physicians, we include our board members. We do focus groups with the community to really try to assess what the needs are of the community and take all of that and make decisions on what programs to offer and what facilities are needed.
And what kind of things have you come up with projected needs?
Yeah, so our big area, a lot of surgical needs. So Overlake has historically been a great surgical hospital, a lot of great orthopedic, cardiothoracic surgery, vascular surgery. We also have an amazing cardiac program, which is continuing to grow, and also neurosciences. And then probably one of the biggest areas, which was one of our key drivers for Project FutureCare, was our childbirth center. We deliver almost 4,000 babies a year in our childbirth center now, and the staff does an amazing job. Our physicians are awesome. Now we want to build facilities that are world-class to match that world-class care that's given in the facilities we have today.
What does, in your opinion and at Overlake and your philosophy, what does world-class care mean to you folks?
Really, for us, it's really providing that high-quality, safe care with the patient experience that people want and deserve, and that's what we work on every single day.
Healthcare, I mean, in today's world, it's confusing. I mean, for us in physical therapy, you know, and the insurances and navigating who pays what's reimbursed. How does that work in the hospital? Because I'm in the outpatient environment, you're in the inpatient environment, and the insurances are a little bit different in those environments.
You know, our biggest payer is Medicare. So that's, for most hospitals, our biggest payer is Medicare, and we basically get what they pay us, and that's not something we really negotiate. But we are able to negotiate contracts with many of the managed care payers in our region, and we do that and have contracts with all the major payers so that people that want to use Overlake services can, because we're a provider for them. One of the things that is exciting around the reimbursement world with the hospital is what's called value-based purchasing. So Medicare actually has a system where they withhold money from all the hospitals and then they put it in a pool, and then based on how hospitals do around clinical quality, patient safety, patient experience, and then also how they drive down the cost of care, then hospitals can either get their money back, earn a bonus, and in some cases actually get a penalty. And we're very proud at Overlake. For the last 3 years, we've actually received a bonus in that program because we're providing that outstanding, high-quality patient experience that people want on the east side.
And this is based on what the patient says about their care.
Correct, yeah, and we do surveys all the time for our patients so that we can actually judge the experience of our patients based on the feedback that they give us. So that's really beneficial and influential in what we do.
Back with more from Shannon O'Kelly and Tom DeBord right after this timeout on Komo.
It's a Northwest Lifestyle Weekend on Komo News. IRG's Health Talk continues.
We continue our conversation with Tom DeBord and Shannon O'Kelly from Project FutureCare.
Well, Tom, once again, thank you for joining us. How exciting it is to be in the healthcare business right now for you, an inpatient, and I know for me, an outpatient. Particularly, we just talked about value-based reimbursement. We all want to provide the great customer service and care. That's really what we're all about in healthcare. But also, we need some physical space and physical plant to do this. And you've got some big things going with some physical plant development and growth. Tell us about some of the growth there.
So Project FutureCare has three main components. We're building a new bed tower. We're really excited about it. It's 5-story, 240,000 square foot bed tower to replace our old East Tower, which was built in the early 60s. We're going to have a dedicated orthopedic unit, which is right up your alley, so we can take care of all those patients. We're going to have a physical therapy gym in there and have support spaces to take care of those patients coming out of their joint surgeries and other orthopedic surgeries. We're going to have a telemetry unit, so a cardiac step down, a medical oncology unit. 2 of the floors are dedicated to the childbirth center, so a labor and delivery floor and also our mother-baby unit. And then we're also going to have other support services like a new pharmacy and a new lab. But the building, as big as it is, it's because we really want to increase the size of our patient rooms. We're very focused on making sure we can meet that patient experience, so larger rooms so that we can accommodate the patient's needs. And then lots of the family members want to come and be part of the care now, so we want to make sure we have space for the families to come in as well, and then also for our caregivers. So we're really excited about that. We're also building 2 brand new operating rooms, a brand new cardiovascular OR and a brand new hybrid OR, which is kind of half cath lab, half operating room. And then we're also going to do some renovation of other rooms inside our current operating suites so that we can continue to expand our services for other surgical programs. And then lastly, Project FutureCare, we're going to build a brand new behavioral health unit. So we are 100% committed to behavioral health services on the east side.
Huge need.
It's a huge need. We are the most comprehensive provider of behavioral health services on the east side, and building a brand new unit to be able to meet the needs of those folks for years and years to come. It's really important for us.
Tom, are you a busy guy?
Very busy, very busy.
I was just going to say.
But exciting. It's an exciting busy.
You have a ton of passion. I mean, Overlake is in good hands from an operational standpoint. That's great. What we see in healthcare, and I think the cool thing, if I can say cool thing in healthcare, the cool thing today is I think providers, the physicians, physical therapists, I think we're realizing how important it is to get the patient involved in the care.
Absolutely.
And when a patient has control, the outcomes are way better. And really hospital-based, you're doing a lot of things in the rooms where patients have control over their care.
Yeah, absolutely. And one of the things we did too is that as we were doing the planning for Project FutureCare, we created innovation teams. And those innovation teams were made up of staff, physicians, but also what we call patient family advisors. So these are actual current or former patients or family members of patients that are helping us to basically build these facilities from the lens of the patient. It's really important.
When will this Project Future be completed, or will it be a project into the future?
Yeah, no, it's a few years out. So the new bed tower will be done by the end of 2020, and the entire project, including the new ORs, the new behavioral health unit, and all of the finishing touches, will be done by 2022.
Well, again, Tom, thank you for your time and information. Obviously, Overlake is in great hands, and the people on the east side are in great hands. Thank you for what you do.
Great. Thank you so much for having us. We appreciate it.
All right, you've been listening to Tom DeBord, COO of Overlake Medical Center and Clinics, talking about Project FutureCare. More information available at overlakehospital.org. This is some great work they're doing.
Yeah, great work, and Tom is so passionate about his work. I mean, just listen to him.
Yeah, it's going to be interesting to see how this comes about, because it looks like they've really got all this very well organized and a lot of great people behind that as well. We're going to come back with our final segment and get you ready for Halloween, and take our final segment with IRG Physical and Hand Therapies Health Talk coming after this time out on Komo.